Okay, so welcome to our next lesson here in our anatomical chapter of the lower back secrets. And this is kind of, I won't say a review, but I will say that maybe you've heard some of this stuff before and maybe it's starting to sound familiar. And I hope that's the case actually, because a lot of this information, hearing it from different angles is really helpful so you can see this for yourself. Okay, so now we're going to really talk about what I call the reasons for lower back pain. And this is going to talk about some anatomy, we're going to talk about some names and muscles that we've already been using, and we're going to put it all together. So here's the big picture. The big picture is that your hamstrings, once again, remember I said your hamstrings are going to be really important here? Here it is, okay? Your hamstrings are attached to your sitting bones. Sound familiar? Yes. Your sitting bones are the bottom of your pelvis. Okay, so here once again, we're going to have our bones here. The hamstrings are attached to sitting bones. Sitting bones are the bottom of the pelvis. Okay, guess what? We know now forward bending requires pelvic rotation. Okay, forward bending requires pelvic rotation. But when the hamstring groups are tight, pelvic rotation doesn't happen. Pelvic rotation is limited. And when pelvic rotation is limited, the stress or the strain will be moving to the lower back. As it moves to the lower back, it has kind of two different places that it can reflect. Stress or strain from hanging like this can come into a herniated disc, or stress and strain can come into the sacroiliac zone, which is the zone right here where the sacrum meets the ilium. That's actually my personal history. I was doing certain practices and being pushed down and forward bending, really pushed and pushed and pushed. And so in my case, my sacroiliac ligament is overstretched and my sacrum is what's called destabilized. And I had back pain for many years until I figured out the system that I'm sharing with you now. So I know intimately well this one. If you're a therapist, if you're a teacher, if you're someone who's coaching other people in their back pain, there's a lot of different people that might be studying this course. And when you do guide or coach your clients or your students or your patients into what they need to do to get rid of the back pain, and you're going to be coaching them on bending their knees and doing certain actions, and they're going to say, well, but why do I have to bend my knees? Well, they're going to say, why do I have to bend my knees? And you're going to say, well, the reason why you have to bend your knees is because the hamstrings are attached to the sitting bones. The sitting bones are the bottom of the pelvis. Forward bending requires pelvic rotation. But when the hamstrings are tight, pelvic rotation is limited. And when pelvic rotation is limited and we do forward bending actions anyway, the stress or strain goes right to the lower back. And so that's why we have to bend our knees. Okay, so it's a simple description of anatomy, of kind of relating all those new muscle names to the bone names, to then the injury names, so you can really see that's what's going on here, okay? Muscles are limiting range of motion. As a result, then actions happen anyway without the proper capacity, the proper range of motion, and then stress or strain is coming to one or more parts of the lower back. And whether this is for your own edification, to heal your own back pain, or for helping everybody else in your life with their back pain, this lesson here of understanding the relationship between the hamstrings, the pelvis, pelvic rotation, and back pain might be one of the most important of all. So see you at the next lesson.